look at what's become a nightly ritual all around Portland. People making noise, expressing their gratitude for healthcare workers bravely treating people for COVID-19. And you can hear everyone cheering right now. There they go. You can see them on their balconies, with their bells, with their pots, with their pans. This is in the Pearl District at 10th and Northwest Flanders. And we know that similar scenes are playing out all over the city, all over the area, in the suburbs too. And we just love seeing that. And joining us live tonight is the man behind that idea, Portland Mayor Ted Wheeler. And Mayor Wheeler, you put out the call a few weeks ago for people to join in this 7 p.m. show of support. Did you really think it would be this successful?
Yeah, honestly, I can tell you I did. Look, this is a difficult time for Portlanders. We're all isolated, but the reality is this is one way that Portlanders can come together, and I knew that Portlanders would have each other's backs. And this, my neighborhood's going crazy right now, and what they're doing is they're supporting our frontline workers. So not only the nurses and the doctors, but everybody who works in the healthcare profession, the men and women who work in our grocery stores and keep the food on the shelves, the people who are working, as you just showed earlier in your earlier segment, the people who are keeping our streets going, our buildings operational, providing takeout food. And this is just a great way for us to all, while we're distanced, to still come together and support the people doing the hard work to keep this city going throughout the crisis. And yes, I knew people would respond to this because Portlanders have each other's backs. They always have. They always will.
They certainly do. And as you were talking, we were showing a live picture, and the people are still cheering. So that's great. I know in my neighborhood, they stop after about a minute. So that is so great to see everyone still going there. And Mayor Wheeler, we're going into week 4 of this, new way of life. The numbers are showing that, Oregonians and residents in Portland are staying home. What is your best guess on a timeline when things might ease up?
Well, look, I'm not going to guess, but here's what the public health authorities told us. They told us if we acted early and if we acted aggressively, we could have the best shot of getting through the public health crisis as quickly as possible. And the resulting economic crisis obviously will be shorter if we can maintain that important physical distancing. Portlanders have been really good about it on the whole. Oregonians have been good about it on the whole. And what we're hearing from the public health officials is because we maintain that physical distancing, that may have reduced the spread of COVID by as much as 50 to 70%. So in terms of when we'll get out of this, we know it's sometime after the peak. The Oregon Health Authorities indicated the peak exposure time will be sometime later this month. And I think of this sort of like antibiotics. You don't stop taking antibiotics when you feel better. You stop taking antibiotics when the risk of further exposure has passed. That'll be the case here. So I know the governor will lift her order based in large measure on advice she's getting from public health authorities, medical experts, and others. And that would be my advice as well.
And, that's good news, 50 to 70%. That's great numbers. But, this is also such a tough time, especially for small businesses. What do you say to small businesses struggling right now? I know thousands applied for help and only 200 can get a loan through Prosper Portland. What's your message to them?
Well, first of all, we knew that the economic consequences of this were going to be serious. And so I'm proud of the fact that the city of Portland acted earlier and more aggressively than any other branch of government. We started off with our Economic Impact Fund right away. We sent $150,000 to the J District in Southeast Portland because we know those businesses had been hit very early on. We convened dozens of small business owners and operators from different aspects of small business, and we created our Small Business Impact Fund. The City Council quickly allocated $1 million towards that. Our Economic Development Agency, Prosper Portland, added $1 million to the mix. And maybe the most exciting part of this is the private sector came forward with another $1 million. So that's grants, 0 to low interest loans, and other support for our small business owners and operators.
And the city itself, the city of Portland is struggling through this shutdown financially. It could cost the city millions of dollars. How do you recover from something like that?
Well, obviously the cuts on the front end are going to be tough. We know that the impact to our general fund will be somewhere in the neighborhood of $100 million. But the other bureaus, for example, the Parks Bureau lost virtually all of their revenues right away that come from their fee-based services. The community centers were closed. So right away, that had a significant impact. We saw that gas taxes went down to zero, parking meter rates went down to zero. That's having an impact of about $9 million a month on the Portland Bureau of Transportation's budget. But look, it's not all bad news. I hope we take this opportunity to really think about how we deliver services, not just think about where we're going to make reductions, but how can we organize government more effectively so that we come out of this leaner, meaner, and more responsive to the needs. Just one example I give is around public safety. We really need to look at all of the back office expenditures in the Police Bureau, the Fire Bureau, or Bureau of Emergency Management, Bureau of Emergency Communications. They all have their own administrative back office functions, their own finance functions, their own public information officer functions. We should be consolidating those resources. So it's not just about reducing services, it's thinking about how our government can be smarter, more cost-effective, and more responsive to the needs of the community. And so those are some of the opportunities we're looking forward to.
You know, talking about cuts, tough times for the Parks and Recreation Department. I know 950 layoffs. You know, if and when will you be able to bring those people back?
Well, again, it's hard to tell when this economic crisis will end. Those 950 people were largely people that we'd start hiring about this time of year. Think of the instructors in our community centers, the lifeguards at our public pools, the people who maintain those facilities. Unfortunately, those cuts were felt quickly and severely for those public employees. The bottom line is this: if we maintain that important physical distancing, if we stay on top of it, if we're aggressive about it, if we take it seriously, and we don't break that social distancing too quickly, we have a faster opportunity to get through this crisis. So I'd like to bring those employees back as soon as we can, but that's really dependent upon making sure that we're beyond the public health crisis. And my message for Portlanders is, I understand it's beautiful out right now. People are going a little nuts, being inside all the time, but this is a critical phase. We're getting close to the peak exposure time for the pandemic in the state of Oregon. This is when we really need to buckle down and ask people to stay at home, maintain that physical distancing for now, even though it's tempting to go outside, because this is where the rubber really meets the road. And so as hard as it is to ask people to stay inside, this is the right time for people to really make that sacrifice, make that commitment. Do it for your own health and well-being, do it for your loved ones' health and well-being, do it for the community. The sooner we get through this, the sooner we get our economy back on the rails.
Right, I know it's so beautiful out, and you know people are going to go outside, so that is a good message. So let's talk. So I know you don't want to talk about, I know you don't want to guess when this might be over, but are you planning for some of those parks and recreation programs this summer? I mean, pools opening, camps, that sort of thing.
Look, we're planning for every eventuality, but I'm not going to hazard a guess as to when this is over. I will make my decisions based on what public health authorities and medical experts tell us in terms of the spread of COVID-19. Obviously, the key thing here is to get beyond that exposure point and then start talking about resilience. But I've got our council members, our 26 bureau directors who I think are highly effective and innovative leaders. We have others in the community that partner with us. We're already talking about our plans for resilience through the crisis and what our recovery strategies are going to be beyond the crisis. And that includes the community in terms of things like rent assistance, mortgage assistance, as well as on the business side, making sure that our small businesses get through this. We're a small business town. 80% of the people in this city are employed by small businesses. And so we're working right now to not only support them through the Small Business Relief Fund and our impact task force, but we're also thinking about what it's going to take for them to recover on the other side of this. We need to have those supports in place, and we need to be thinking about them now, and we are.
All right, Mayor Wheeler, thank you so much for your time and for joining us. We really appreciate it.
Thank you. We appreciate it too. Thank you.
All right, up next, it's one of the most common questions we're getting: why the mask guidelines have changed. We'll have the answer. Welcome back to KGW Q&A. You know, we've received so many questions about masks. And since last week, a common one has been, why did the mask guidelines change? Francis Abbey has the answer.
This is U.S. health officials advising against the general public wearing masks in early March.
Should you wear a mask if you're healthy?
No.
There is no advantage to you wearing or buying a mask.
Now states and the federal government are changing their tune on who should wear a mask.
Wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain.
So, what's the deal with masks? To start, let's take a look at the CDC's initial guidelines on masks. It says the CDC does not recommend healthy people to wear a face mask. It should only be used by people who have COVID-19 and are showing symptoms. That sounds pretty straightforward, right? But how do you know if you are healthy? Well, from early on during the outbreak, we knew that some people who are infected with the virus may not show symptoms for up to 14 days. This is called the incubation period. And it's possible for someone to spread the virus even when they don't have symptoms. But we didn't quite know to what degree this occurs and how much it drives the outbreak. That's where countries diverged on their guidance on masks. U.S. health officials believe that
asymptomatic spreading, which we've seen some evidence of, but not the major driver. You really need to just focus on the individuals that are symptomatic.
Adding on top of that was the pragmatic concern that a run on masks could worsen the already severe shortage of medical supplies for hospitals, and the fear that masks may give people a false sense of security. So the CDC decided not to embrace the mass public use of face masks. Meanwhile, the same evidence led health officials in Asia to a different conclusion. Countries started advising or even mandating that healthy people wear masks in crowded places, citing fear of asymptomatic transmission. As expected, the demand for masks in those places skyrocketed, causing an immediate shortage, which was eased by government intervention. And then,
now 80 cases in the U.S.
3,000.
16,000. More than 160,000 cases in the United States.
More coronavirus cases than any country in the world.
As the outbreak accelerated in the U.S., new cases of asymptomatic transmission challenged the reassuring message by health officials about the way the coronavirus spreads.
COVID-19, it's being spread by these silent spreaders. How can you tell people to only wear a mask if they're sick, if they don't know if they're sick?
Evidence grew stronger suggesting asymptomatic transmission may be responsible for more cases than previously thought, eventually prompting the CDC to adopt new thinking about the benefits of masks.
With the new data that there's significant asymptomatic transmission, this is being critically re-reviewed.
One reason why some Asian countries have promoted the idea that the general public should wear masks from the beginning is likely because of their experience with SARS, a 2003 epidemic of a virus similar to the coronavirus and that spread mostly in Asia. One study found that always wearing a mask when going out was associated with a 70% reduction in risk. SARS also fundamentally changed how people in Asia view masks, removing the stigma of wearing masks in public. But the mask debate comes with two big caveats. First, there is still a dire shortage of personal protective equipment in hospitals across the country, putting medical workers at increased risk of contracting the virus.
They're having us use the same mask between patients and using single-use masks up to 5 times or more.
We desperately need to address that to give our frontline healthcare workers the best protection they deserve. And second, masks are not magic shields, and they cannot replace social distancing. Countries like South Korea that successfully flattened the curve did so by combining mask wearing with mass testing, social distancing, and rigorous contact tracing. Only by using a combination of methods and by working together can we effectively stop the spread of the coronavirus.
And up next, the coronavirus has canceled a lot of big milestone celebrations. A parenting expert answers how to help kids cope with disappointment. But first, a lot of viewers are asking, can I attend holiday celebrations like Easter this weekend? The answer, the Oregon Health Authority says you can celebrate holidays by staying home. They suggest connecting with friends and family over video calls. And some churches are offering virtual services. You know, for kids, this health crisis means cancellations for graduations, proms, birthday parties. How can you help them cope with the disappointment? That's a big question on many parents' minds. Ashley Korslin has some answers and advice from a parenting expert.
So the first tip is to really validate how and what your kids are feeling. Let them know that you're here for them, you're here to listen. Try not to discount what they're feeling. Don't say things like, hey, it's gonna be fine, don't worry about it, buck up. You just really wanna validate those feelings. Try not to talk to your kids when they're having a very emotionally charged moment, if they're really emotional or really upset, because that's not going to solve anything. But something that will help them, if they're not ready to talk to you, maybe suggest suggest that they talk to a friend. Say that they should journal, or suggest going on a walk or listening to music, maybe drawing, expressing their feelings in that way. And the last tip from the experts is to let your kids know how you are feeling. It's okay to be positive about things, and you should, but sometimes you just need to be vulnerable and just be transparent that, hey, I'm stressed out too. We are going to get through this together, but let them know that you are in it as well.
Great advice from Ashley. And you know, calls to the Oregon Child Abuse Hotline are down significantly right now, but not because abuse is happening any less. It's just not being reported because, unfortunately, kids have fewer eyes on them. In fact, child abuse prevention advocates say financial troubles and stress can lead to more abuse and neglect. I mean, it's scary information, leaving many people wondering, you know, how can I help? Morgan Romero talked to advocates to find out what you can do to protect children right now.
So we're asking parents and individuals, grandparents, aunties, uncles, to call and check in on your family members. Make sure your single mom friend is okay. Make sure, you know, the family who just lost their job, maybe they need a hot meal brought to them to just ease the stress. I think right now everyone needs to feel like they're cared for, someone's looking out for them, and that's the parents too. And so we want to lift up this message of it's really on all of us to keep kids safe right now, to keep ourselves from being at our wits' end with our kids, and also to support our friends, neighbors, colleagues, faith partners, anyone we're involved with. Just make that extra touch right now so they know they're not alone.
And coming up, how you can use a new website to check your symptoms.
Together.
You know, with all the pollen in the air, people are having really bad allergies right now, but those symptoms are very similar to COVID-19. Well, Lindsay Nadrix explains there's a new tool in Oregon for checking your risk of COVID-19.
Okay, so here's how it works. The website is c19oregon.com. When you click Get Started, you first have to accept the terms and conditions. Then it will take you to this page where you start by entering your age. It then asks for your zip code. This is so health officials can track where possible cases are happening and direct people to the right services, like a nearby urgent care or hospital that has open space. Next, it will ask you what symptoms you have. Check all boxes that apply, then hit Next. Your symptoms will then determine what recommendations you see and what resources you'll be connected to. Health officials hope it will help people make more informed decisions about their health and keep people out of the 911 system.
And tomorrow night at 7, we will bring you a special edition of Straight Talk. Laurel Porter talked with House Speaker Tina Kotek about the possibility of a special legislative session to address the coronavirus crisis.
For the legislature, we can either be in special session as called by the governor, or we can, and additionally, do an emergency board where an emergency board could spend some one-time emergency dollars for rent assistance or food assistance or helping small businesses. So I think that's what we're focusing on right now.
When we face adversity, we find a way through it. It's about taking care of each other. It's the small parts that make a big difference. At Chevy, we promise to do ours. We're offering current